Hello and very good evening, everyone. I hope I'm audible and I'm visible. Let us start today's discussion with community medicine, and the topic that we are going to take today is mother and child health, immunization, and so on. So, I hope if you are able to see me or if you are able to hear me, please send me a thumbs up or something so that we can start on. Good evening, everyone. Yeah, so hi Shriyam, hi Fomo Medico, hello Nitish Kumar Bhagat. Let us start with the mother and child health topic. I hope you all are studying, and this schedule that we are giving you, it is a weekly schedule. See how it works is every week, how it will work is every week I will give you one schedule, and that schedule is usually chapter wise, and then on every Wednesday I will be live to discuss the previous INICET exam questions, plus we will also discuss more important high yield topics which you should be remembering for your exam. So of course this whole video session is not to cover the syllabus. Yeah, iske upar many students started messaging me that sir, I'm attending your weekly sessions. Is that enough? I would not say that this is enough, but yes, definitely if you have studied everything, then this as a revision mode, yes, this is purely enough because you are able to revise, you are able to fix your targets, and you are able to perform that every day. So make sure that you are able to perform every day. ये एक मैंने बात ज़रूर आपसे कहनी थी that many students said me that sir, INICET exam is just on my head and I don't have any level of motivation how to study and how to go about things like this. Please note that motivation मतलब कहाँ से, ये तो आपके अपने अंदर की चीज़ है ना. आई एम वेरी बैड एट मोटिवेटिंग पीपल, बट व्हाट आई नो फॉर श्योर इज व्हाट मोटिवेट्स मी दैट मैंने ये 5 वीक का शेड्यूल बनाया. What motivates me? I covered 1 week and I was very happy with my performance. Now I was waiting for the next week. So if you every day are able to show some progress या कुछ आप चीज़ accomplish कर लेते हो, that accomplishment is very big amount of motivation for you. Okay, so whatever you are doing every day, कुछ ना कुछ MCQs रखो. अराउंड 50 to 100 MCQs से आप स्टार्ट करिए. यू स्टार्ट फ्रॉम, सॉरी नॉट 1000, 50 to 100 MCQs से आप स्टार्ट करिए, एंड देन यू प्रोग्रेस टूवर्ड्स रीचिंग अ 300 MCQ गोल पर डे. You progress towards reaching a 300 MCQs per day, and you start with anything within 40 MCQs, 50 MCQs, and then you progress forward. ये डेली का जो प्रोग्रेस है ये आपको खुद ही मोटिवेट करेगा. एनीवेज, लेट्स नॉट वेस्ट टू मच ऑफ टाइम. लेट्स गेट ऑन एंड टॉक अबाउट दीज MCQs. दीज ऑल हैव बीन प्रीवियस एग्जाम क्वेश्चंस, बट मोर देन एग्जाम क्वेश्चन, these topics have been asked in your INICET exam also. ये जो टॉपिक है ना, जो आज का टॉपिक है मदर एंड चाइल्ड हेल्थ, दिस इज नॉट अ वेरी हाई यील्ड टॉपिक फॉर योर एग्जाम्स. मदर एंड चाइल्ड हेल्थ से यूजुअली देखा गया है INICET एग्जाम में देर आर यूजुअली लाइक 2 to 3 MCQs ओनली. इट्स नॉट लाइक एपिडेमियोलॉजी, इट्स नॉट लाइक बायोस्टार जहाँ पे बड़े भयंकर MCQs आएंगे. लास्ट ईयर आई थिंक वी गॉट 2 MCQs फ्रॉम वैक्सीनेशन. बोथ ऑफ देम वर ऑन वैक्सीन वाइल मॉनिटर्स. बहुत सिंपल MCQs थे. फिर एक क्वेश्चन आया था फ्रॉम मदर एंड चाइल्ड हेल्थ. इट वाज अबाउट द JSSK, जननी शिशु सुरक्षा कार्यक्रम. इट वाज अगेन अ वेरी सिंपल MCQ. वेरी इजी MCQs, 2 to 3 MCQs you may get in INICET exam. Let's move forward and talk about the first MCQ. देखो ये MCQ, I'll wait for your answers and let's see if you are able to give me answers for this. Consider the following and mark the incorrect. Which one do you think is incorrect answer? IMR is 28 per lakh live births, MMR is 97 per lakh live births, crude birth rate is 19.5 per thousand population, and lifetime maternal risk is 0.21%. Which one do you think is the wrong answer? What do you think is the wrong answer? Mark the incorrect one. You have to mark the incorrect one. So you have to mark the incorrect one. Is it IMR is 28 per thousand per lakh live births? MMR is 97 per lakh live births. Crude birth rate is 19.5 per thousand population. Lifetime maternal risk is 0.21%. क्या बोलते हो इनमें से कौन सा आपको लगता है सही आंसर है? So IMR is 34. No, beta, IMR is 28 only. Shriyam, IMR is 28 only. So, sir, ये programs के detail याद करना ज़रूरी होगा. Always confused. No, beta, you don't need to remember the program details, but yes, sometimes these may be asked in your exam. Option Abhinandan says option A. Minakshi is option D. Abhinandan is IMR 35.2. Nahin beta, IMR is 35.2. That is very long time back. This is the most recent correct answer. IMR is 28. IMR is 28. बिल्कुल सही है ये. IMR is 28. This is as per the latest 2022 data. I don't know क्यों आप लोग ऐसा कर रहे हो. Demographic data I have shared on my Telegram group all the time. And it's there on my Instagram page also. So Instagram page and Telegram group, these are two sources जहाँ पे आपको सारे updates मिल जाएंगे. So make sure that you are following them. Sir, I learnt IMR 34, MMR 103. Should I change? Shriyam, yes, you have to change. These are very old data. So IMR is 28. This is correct. MMR is 97 per lakh. This is also correct. CBR is 19.5 per thousand population. This is also correct. Lifetime maternal risk is 0.21. This is also correct. बिल्कुल सही पहचाना कल्पना लोधी. I think ये the student was waiting since very long time कि ये क्यों ऐसा बोल रहे हैं कि ये करेक्ट है बेटा. दिस इज नॉट पर लाख. ये आपको लगता है पर लाख लाइव बर्थ्स है. दिस इज नॉट पर लाख लाइव बर्थ्स. दिस इज अ रॉन्ग आंसर. इट इज नॉट पर लाख लाइव बर्थ्स. इट इज पर 1000 लाइव बर्थ्स है ना. ये IMR का फॉर्मूला में ही प्रॉब्लम है. इट इज़ पर 1000 लाइव बर्थ्स. सो दिस इज़ अ वेरी सिंपल बेसिक MCQ. ये गलत नहीं होना चाहिए. ये देखो मैं आपके लिए लेकर आया. दिस इज़ द डेमोग्राफिक डेटा अपडेट. दिस स्लाइड का यू कैन टेक अ स्क्रीनशॉट. इट इज़ अ 5-star MCQ टॉपिक and this is very frequently asked in your exam. It is all the latest data up till year 2022. So 2022 तक का year का ये latest data है. You should be remembering this and you should be doing this data. Birth rate, beta, please note, birth rate is 19.5 per thousand population. Death rate is 6.0 per thousand population. Infant mortality rate is 28. Neonatals अगर आपने याद करने हैं तो ठीक है, नहीं तो whatever I am highlighting, you just need to remember this. Whatever I am highlighting, you just remember this. Maternal mortality rate and ratio दोनों में फ़र्क है. Please remember maternal mortality ratio is 97 per lakh live births. So आपने जो याद रखना है birth rate, death rate, MMR ratio. Then you should remember the sex ratio also. Sex ratio for India, it is 1020. This is fairly important for us to remember. Couple protection rate is 67. Annual growth rate, you should also note the total fertility rate. You should also remember the total fertility rate. Total fertility rate for country India is 2.0. This can also be asked in your exam. There's also important update data for you. Total fertility rate is 2.0. Couple protection rate, ठीक है. Institutional deliveries, you can just leave around. If you want, you can remember these datas, but whatever I have highlighted, whatever I have tick marked, these are very important for your exam. TB incidence is 312. This is the latest update. Leprosy prevalence, ये पूछा जा सकता है बेटा. Leprosy prevalence in India, it is 0.5 per 10,000 population. इसको याद रखना. It is per 10,000 population. So leprosy prevalence is 0.5 per 10,000 population. ANCDR, annual new case detection rate, that is 8.1. That is ANCDR is 5.5 per lakh population. ANCDR is 5.5 per lakh population. It is not 8.3. It is 5.5 per lakh population. Right? HIV prevalence is 0.2. If you want, you can remember. So बस यही हैं जो चीज़ें आपको याद रखनी है. Please remember, leprosy का prevalence आपको याद रखना है. TFR, sex ratio, MMR, birth rate, death rate. That's all. So these are important data for you. Sir, 188 is that TB prevalence rate? No, 188 was old answer beta. It has been increased to 312 per lakh population. That is the total TB prevalence. So 312 per lakh cases. 312 per lakh cases. That is old purana data tha 188 because that time there was a dip in the notification rates and the TB notification was decreased because of COVID-19 pandemic. Us karke we had dipped down to 188, then we increased to 212 and currently it is 300. That is what average we had been maintaining over so many years, around 300 cases per lakh population in India. That is TB new cases. पेरिनेटल पीरियड और पेरिनेटल मोर्टालिटी रेट अलग टाइमलाइन है क्या? आई विल जस्ट टॉक ऑन दिस लाइन ऑल्सो. पेरिनेटल मोर्टालिटी रेट बेटा, what is perinatal mortality rate? So if you talk about the perinatal period जो WHO कहता है, that is from 22 weeks till 7 days of life. This is what WHO says, till 7 days of life. That is what WHO says. Okay, perinatal period as per the WHO. ये perinatal period WHO की definition जो है, this is only as per WHO. If they ask you perinatal mortality or they do not say anything और कुछ do not mention, अगर कुछ भी नहीं mentioned या फिर mentioned है national health mission या फिर और it is mentioned as per the government of India, अगर ऐसा कुछ आ गया perinatal mortality या perinatal period as per government of India या in case nothing is mentioned, then you should be marking this perinatal mortality is from 28 weeks till 7 days of life. That is what is the perinatal mortality period according to the government of India, National Health Mission, Ministry of Health and Family Welfare. अगर specifically, if it is specifically mentioned WHO का बताओ, then of course you are going to mention the WHO thing ना. But in case nothing is mentioned, then you are bound to answer the government of India data. फिर ये government of India 28 day to 7 day. So कहने का मतलब है, let me just simplify this whole game for you, that I want you to remember is only this. I want you to remember only this, that perinatal mortality period is from 28 day to 7 days. हाँ, अगर WHO लिखा जाए, then you should remember WHO. If it is written, then you should remember 22 weeks till 7 days. Otherwise, keep it simple, keep it easy. Perinatal mortality is from 28 weeks of gestation till 7 days of life. Okay, so from 28 weeks of gestation till 7 days of life. Okay, so what is the best answer you're going to mark over here? Consider the following and mark the incorrect one. What do you think is the best wrong answer? It is the best wrong answer that you would like to mark is IMR. That is false. It is not per lakh live birth, it is per 1000 live births. Let us move to the next MCQ. Find the incorrect match option. Suman scheme is service guarantee, no tolerance to denial. Jai Vigyan mission is promote the girl child literacy. Muskan is for quality of child friendly services. PM Matru Vandana Yojana is incentive for mother and the child health. What do you think? Which of the following is incorrect? गलत वाला क्या ऑप्शन है? सुमन स्कीम फॉर सर्विस गारंटी, जय विज्ञान टू प्रमोट चाइल्ड लिटरेसी, मुस्कान इज फॉर क्वालिटी ऑफ डिलीवरी सर्विसेज एंड मातृ वंदना योजना इंसेंटिव. सो व्हाट डू यू थिंक इज द रॉन्ग आंसर ओवर हियर? विच वन डू यू थिंक इज द रॉन्ग आंसर? सी ऑप्शन कुछ कह रहे हैं, मुस्कान क्वालिटी ऑफ चाइल्ड फ्रेंडली. बी ऑप्शन Jai Vigyan promote girl child literacy. Kalpana says B. Abhinandan is B. Absolutely correct. Jai Vigyan mission. Please remember, Jai Vigyan mission किसके लिए है? Jai Vigyan mission is to promote rheumatic fever literacy. It is to promote understanding of rheumatic fever. It is for rheumatic fever. It is to understand the causes, the prevalence of rheumatic fever, how many new cases. It is to promote vaccine development. It is also to find out the prevalence of streptococcal infections, strep infections, and prevalence of rheumatic fever in India. So just one point about Jai Vigyan mission. What is the use of Jai Vigyan mission? Jai Vigyan mission, please remember, Jai Vigyan mission is to promote understanding for rheumatic fever in India. First point is it is to understand the prevalence of strep infections. It is also to understand the prevalence of rheumatic fever in India. Rheumatic fever. Also, third is to promote vaccine development for rheumatic fever. Vaccine development for rheumatic fever. These are very important 3-4 points. The fourth point is to understand more about pathology of rheumatic fever and to understand in depth about rheumatic fever. But this is very important mission, that is Jai Vigyan mission. It is for rheumatic fever and not for girl child literacy. That is the wrong answer. Beta, what is Suman scheme? This can be asked in your exam. What do we mean by this Suman scheme? What is the Suman scheme? If you talk about the Suman scheme का जो tagline है, can you see this tagline? Suman scheme is service guarantee charter scheme. Suman stands for Surakshit. Suman stands for Surakshit Matritva Ashwasan. Suman stands for Surakshit Matritva Ashwasan scheme. In this, there are so many elements. I don't want you to remember all these elements. In sub elements की आपको ज़रूरत नहीं है. But just remember, it is for management of sick neonates and infants. Can you see this? It is for management of sick neonates and infants. Then this Suman scheme is basically also for providing the 0 dose vaccination, that is the birth dose vaccination. It is to promote breastfeeding in India, and it is for basically for anything pertaining to mother and child health. So Suman is like a big thing. It is a very big thing, right? In this, you can also see it is for 0 expense access to identification and management of maternal complications, elimination of mother to child transmission of HIV and syphilis, so on and so forth. So this is a very big scheme. And in this, there are a lot of elements. It is primarily to provide a healthy mother and a healthy child. That is what is Suman scheme, Surakshit Matritva Ashwasan scheme. Coming to what is Muskan. Muskan is a new scheme which was developed somewhere in 2019 to 2020. So 2019-2020, it was developed and it was launched under the National Health Mission. It is to provide, please highlight this, it is to provide quality healthcare to all citizens in country in equitable manner, especially to children up to 12-year age group. This can be your MCQ. It is to provide access to health facilities to children age under 12 years. So basically, we want a quality of health services in a child-friendly manner. So quality child-friendly services in public health facilities to reduce preventable newborn and child mortality and morbidity. So this is what is the main thing you should remember. What is Muskan scheme? Muskan scheme is for goal of Muskan is to ensure provision of quality child-friendly services in public health facilities to reduce maternal mortalities and child mortalities and morbidities. Next is there are many things that you should be remembering for mother and child health. One is you should know what is Suman scheme, that is service guarantee. Then you should also know that there is universal screening for gestational diabetes mellitus. When do we do GDM screening? It is done 2 times, first within 12 weeks and the second is done from 22 to 24 weeks. So GDM screening is done for all females. Then GSY, that is giving money to the female. Then there is midwifery initiatives, having more midwives so that there is more trained deliveries even in the rural areas. Comprehensive abortion care services. This is a 5-star MCQ for you. This can be asked in your exam about comprehensive abortion care services. I think everybody should be aware about the MTP Act. You remember about the MTP Act? I have not written about the MTP Act, but that is one thing you should be remembering. Let's just write a few points about MTP Act. Amendment 2021, MTP Amendment 2021, that now we need only one doctor consent till 20 weeks. From 20 to 24 weeks, in case the abortion has to be done or the medical termination has to be done, it has to be done with two doctor consent. And in case of any in certain situations, there are many indications. In certain situations where the life of the mother is at risk, even the abortion can be done even beyond 24 weeks, but under the approval of a medical board, which is a medical certified board. So it is a medically recognized board, and they are going to give you the consent to do MTP even after more than 24 weeks. The MTP can be done by approval from medical board. Medical board approval is required. For age more than 24 weeks, even the abortion can be done. So this is very important. Comprehensive abortion care services under the CAC. Lakshya scheme has already been asked in your INICET exam. It is to improve the quality of labor room in labor room services in India. Pradhan Mantri Surakshit Matritva Abhiyan, that is to promote more ANCs in rural areas and to do screening for females during ANC, and to categorize them using color codes. So I think flashcards has been shared about PMSMA, that there is blue color for pregnancy induced hypertension, yellow for any other comorbidity, red for any high risk pregnancy, and green is for general population. So these are key interventions which can be asked to you in your INICET exam. This is a 5-star MCQ table for you. So please remember every word that I have sent. So rape 24 weeks, yes, in certain situations as social injustice, as rape victims, and in case there is the female comes to know about the pregnancy later on in these cases. Also in MTP, the failure of contraceptives have been added as an indication of medical termination of pregnancy, both for males or for females. You should also remember about Pradhan Mantri Matru Vandana Yojana, PM Pradhan Mantri PMM Matru Vandana Yojana. Matru Vandana Yojana, it is to give them, this is the logo for Pradhan Mantri Matru Vandana Yojana. It is to give incentives of rupees 5,000 is to be given in 3 installments. In 3 installments being provided directly under the bank or the post office to the pregnant females and lactating mothers. So that is what is Pradhan Mantri Matru Vandana Yojana. It is only for the firstborn child. So it is only for the firstborn child, and they might get up to 5,000, not up to, it is total 5,000 rupees is given as in 3 installments. When are the 3 installments given? The first installment is given during the registration of the pregnancy, which should be within 150 days of the LMP, that is within 3 months the registration should be done. At least one antenatal checkup should have been completed. They will get the second installment. Then third installment is when the child birth is registered with Government of India and the child has received at least the first dose vaccination. Which are the first dose vaccination? Please note that these are not the birth dose vaccination. First dose vaccination will also include the pentavalent, the OPV, the hepatitis B, the BCG, DPT. So whatever is given at 6, 10, 14, they should have been completed. This is what is the third installment for. So 3 installments, 1,000 rupees, 2,000 rupees, and then last is 2,000 rupees again. Total is 5,000 rupees. They will get the installment in these 3 installments, right? Okay. Next MCQ, let's take on the next MCQ. All are true about Janani Shishu Suraksha Karyagram. This is previous year INICET exam. So all are true about Janani Shishu Suraksha Karyagram, except which one do you think is the wrong one? Except, are we not going to give free diet to the mother during the hospital, free delivery facility, free transport, या free treatment of sick children up to 6 years of age? What do you think is the wrong answer? Absolutely correct देख लेंगे, says up to 6 years. This is the incorrect one. It is not up till 6 years. तो कब तक होता है देख लेंगे. What do you want to say? It is up till 1 year of age. It is up till 1 year of age. Absolutely correct. Which of the following is true about GSSK? Except it is free treatment of sick children up till 6 years. All other are true. So all other are true, and a free transmit is to be given, and free delivery services, and free diet to the mother during the hospital stay. All are correct answers. Absolutely correct. It is given till 1 year. Next MCQ, home-based young child scheme requires ASHA home visit every 7 days, monthly, 3 monthly, every 6 months. Home-based young child scheme. Home-based young child scheme requires ASHA home visits every 7 days, every week, every month, every 3 months, every 6 months. So what do you think is the correct answer? Home-based young child scheme required ASHA home visits every 7 days, monthly, 3 monthly, every 6 months. What do you think? So absolutely correct, beta. This is HBYC scheme. Home-based young child. It is not the HBNC. HBNC is different. Home-based newborn care. Home-based newborn care. Home-based newborn care is separate thing. Home-based young child scheme is separate. So this home-based newborn care had initially been started under National Health Mission, and it gave us a very beautiful and very promising results, and therefore the government of India got very happy and they said, chalo yaar, HBNC was a beautiful thing, why not to start with the HBYC, home-based young child scheme. So under the home-based young child scheme, can you see this home-based newborn care? So under the home-based newborn care, we were already giving very important words. I'm going to say this can be asked in your exam. So please note that under the home-based newborn care scheme, there was strengthening of health and nutrition through home visits. Strengthening of health and nutrition of the child and of the mother. So of course of the child primarily, because it is a newborn care. So it is a newborn care, strengthening of the health and nutrition of the child through home visits. So in this, the ASHA will visit first 42 days of life to support the mother and the newborn, and of course we want to support the mother because we want to support the child also. It is on day 3, 7, 14, 21 and 28. So how many visits can we see? We can see, sorry, there was the 6th one also, that's what I was confused. There is 6 visits. So how many visits we can see? The 6 visits are there. In case of home delivery, now there will be more visits. There will be 7 visits. In case of cesarean section, there will be less number of visits. The third day visit, beta, it is cancelled, and therefore, so in cesarean section, how many visits will be there? 5 visits will be there. So please remember, total visits in any delivery, in institutional delivery, it is 6 visits. In case of home deliveries, now there will be 1 added delivery, that is 7 visits. In cesarean section, if the female is undergoing a cesarean section, in those cases the female is already admitted in the hospital, so therefore there is no requirement of doing a home visit. We only do 5 visits. The third day visit is cancelled. That is regarding the home-based newborn care. So what did you learn? The home-based newborn care is to primarily promote the health and nutrition of the child primarily through the home visits. Now, because the home-based newborn care was a beautiful program by Government of India, now the government launched the HBYC, home-based care for young child. What is the home-based care for young child? That is, again, we are going to do 5 visits. In these 5 visits, these are conducted every 3 months. You have to remember, it is conducted every 3 months. After how many months? It is conducted after every 3 months. So please remember, 3 monthly visits, 3rd month, 6 months, 9 months, 12 months and 15 months, till the child is able to walk and talk and play. Till that time, the ASHA is going to visit to promote the family health, nutrition and development of the child. So it is done till 15 months of age. How many visits are there? 3 monthly visits, and these are total 5 visits. This is a relatively new scheme called as home-based care of the young child. Home-based care of the young child. It is a relatively newer type of scheme. Okay. So what do you want to mark over here? Absolutely correct. Many students have marked it already. Correct answer. It is a 3 monthly visits because it is a home-based young child scheme. The answer will be 3 monthly visits. Answer is 3 monthly visits. Coming to the next MCQ, average extra calorie requirement for a female in her 2nd month of pregnancy. So now the female is reporting in the 2nd month of pregnancy. What do you want to answer? 70 to 90 calories, 230 to 280 calories, 350 to 375, 390 to 470 calories. What do you think you would like to answer? The average extra calorie requirement for a female in her second month of pregnancy. Now the female is reporting in the second month of pregnancy. Average, we are going to give 350 calories extra per day in total pregnancy. This is the general answer. General answer is we are going to give 350 calories per day. So everybody is answering C, C, C. ध्यान से सुनो आप. Please listen to me very carefully. Please listen to this very carefully. Helper says C, Ankit says C, everybody says C, देख लेंगे C, Shriyam, Sara, Minakshi, everybody is answering C. तो C तो गलत हो गया बेटा. दिस इज अ रॉन्ग आंसर. एवरेज हम देते हैं 350 कैलोरीज, बट ये जनरल आंसर है. ध्यान से सुनो. लिसन टू मी वेरी केयरफुली. दिस इज अ जनरल आंसर. व्हाट डू यू थिंक दैट अ फीमेल इज इन हर सेकेंड मंथ ऑफ प्रेगनेंसी, दैट इज द फर्स्ट ट्राइमेस्टर. सो फर्स्ट ट्राइमेस्टर में आप उसको 350 एक्स्ट्रा दोगे. व्हाट इज 350? 350 कैलोरी. कितना होता है? वन रोटी, वन चपाती विल कंटेन 60 to 70 कैलोरीज. सो उसको क्या बोलोगे? दैट शी शुड स्टार्ट कंज्यूमिंग 60 to 70 कैलोरीज पर चपाती. सो टोटल 5 चपाती एक्स्ट्रा खानी शुरू कर दे इवन इन सेकेंड मंथ ऑफ प्रेगनेंसी. ऐसा करना है क्या? सो फीमेल सेकेंड मंथ इज लाइक हाउ मेनी वीक्स? मे बी समथिंग बिटवीन 4 to 8 वीक्स के बीच में हुआ ना फीमेल. सो बिटवीन 4 to 8 वीक्स फीमेल को भी नहीं कई दफ़ा पता होता. फीमेल ऑल्सो डज नॉट नो शी इज प्रेगनेंट. सो हाउ कैन शी स्टार्ट ईटिंग सो मच? प्लीज नोट दिस इज रॉन्ग आंसर बेटा. दिस इज रॉन्ग आंसर. ध्यान से देखो इसको. ध्यान से देखो इसको. This is a flashcard. This is a super duper important flashcard. It has been shared. It is a 5-star MCQ topic. It has been shared multiple times. Government of India says that if the baby is estimated to be 10 kg gestational weight gain, or if the baby is 12 kg gestational weight gain, like the mother is 10 kg or 12 kg gestational weight gain, then in the first trimester, roughly around 70 to 90 calories or 85 calories per day is extra required. In second trimester, when the female will come 230 to 280, and in the third trimester, can you see it is whooping 390 to 470, and this was your INICET previous year question. This was your INICET previous year question. How much calorie extra is required in the third trimester in a female? Option was 450 calories, and that was the correct answer. It is not 350 calories. In third trimester, it is 450, 470 calories. In the first trimester, it is only 70 to 90 calorie beta. एक रोटी दिन का extra कर लो if you can do, otherwise that's okay. It is not nil calories is also a wrong answer. Some faculty, some areas, some people will be saying nil calorie. Nil is not the correct answer. Like female should be getting something extra, right? So around 70 calories per day extra, 2100, she's already 22,000 calories the female will already be taking, right? So just take 70 calorie extra. That's negligible, like nil के बराबर है. But nil answer is not the correct answer, है ना? 70 calories in the first trimester, 250 calories. Easy रखो ना इसको. 70 calories, you can remember it as 70 calories, 250 calories and 450 calories. मैंने ऐसे याद किया. 70 calories, 250 calories and 450 calories. This is much easier way to remember. First trimester, second trimester and third trimester. Average अगर आप देखेंगे, then it comes out to be 310 to 375. So I hope you understand कि ये what type of MCQs will come, and लगा ना आपको धीरे का झटका जोर से. So that is what sometimes happens, that धीरे का झटका जोर से लगता है. Please remember, this is again a 5-star MCQ topic for you. This is a 5-star MCQ table for you. This is, I have prepared from the National Institute of Nutrition guidelines. These I have prepared from the NIN 2020 update guidelines, and I have made this table specially for you. It is total is like around 300 pages guideline, and this 300 I have just tried to make a simple table for you regarding normal female, non-pregnant, pregnant female and lactating female. What is the amount of nutrition which is required during this time. So this table you have to remember many times. The questions come from this. Please note that body weight, it is roughly 10 kgs in the entire pregnancy. How much energy I have gone into the detail. So 350 is just a general answer, but I have already gone into the detail कि कितना female को खाना है energy के terms में. Protein, nobody will ask you. You can just omit protein. Protein, that's fine. Nobody will ask you. Yes, MCQ can be asked about carbohydrates. MCQ can be asked about iron. Iron, I would like to point over here that iron, how much is required during a normal non-pregnant female? Can you see that iron, normal non-pregnant female, it is 29 milligram. It is 29 milligrams. So in pregnancy, it goes up till 40, and can you believe that in lactation, it comes down to 23 milligram, which is even lower than the earlier time. So this, can you see that this 23 is lower than the initial time? So this is very important. Therefore, iron can be very importantly asked in your exam. Iodine is again important. It is very frequently. How much iodine you require? 150. Then we have 250, and then we have is 280. Calcium can again be asked. Please note that the calcium in pregnancy, it is same amount as in a non-pregnant. It is not in pregnancy we need more calcium. Vitamin A, it's old MCQ, nobody will ask you. Folate, yes, everybody knows that usually in non-pregnant it is 200, and pregnancy it is 570. You can remember it is 3 times increased during pregnancy. In pregnancy, how much folic acid is extra? It is 3 times increased. 3 times increased. So फारूकन पठान सर नॉर्सेट में कितने क्वेश्चन आएंगे बेटा? This session is primarily for the INICET exam going students, but yes, NORCET may you can remember 70-60% of this whole syllabus, but NORCET is very important from mother and child health. This topic I will be taking much in detail for NORCET exams. ये जो हम session कर रहे हैं, this is primarily for all the MBBS doctors who are aspiring for the INICET exams. सो वंस अगेन ट्राइमेस्टर वाइज देख लेंगे, कह रहा है वंस अगेन ट्राइमेस्टर वाइज वाला. बेटा इसका फोटो ले लो. मैंने आपको बताया ना, दिस ऑल इज अवेलेबल ऑन माई इंस्टाग्राम. बेटा इंस्टाग्राम पे जाओ, आपको बहुत चीज़ें मिलेंगी, उसको फॉलो करना शुरू करो, एंड यू विल फाइंड लॉट ऑफ स्टफ ऑन PSM on my Instagram channel. And of course उसमें कुछ मेरी personal videos भी होंगी, but there might be some important not might be, there are जितने updates होते हैं community medicine का, I'm always sharing on my Instagram and on my Telegram. So please note that this is what is important. Sir, for protein value should be remembered for calculation 0.8. No. FOMO Medico, please note that for protein, yes, you can remember 0.8, but उसका protein का इतना कोई ज़रूरी नहीं है, but if you want, you can remember. Protein per day requirement is 0.8. Very nice. Yes, Dr. Vishnu, I'll be talking in English. No worries on that. I asked this last time also, but we are going to keep it in English. What I was telling was that this all my flashcards. These are all flashcards. Can you see this number? Can you see this number? This is MMFC 1042. Can you see this number? MMFC 1042. This MMFC 1042, MMFC, it stands for Mukhmohit flashcards. So if you just put this keyword FC flashcards, you will find serial number of, there are around 2000 flashcards I have shared in community medicine. So these flashcards will be asked in your exam, and this was your previous year exam question also, right? So yes, Farooq Pathan, yes, I understand NORCET nursing के लिए है, तो very good that you are attending it. Very nice, keep it up, beta. So what are you going to mark in this? Average calorie requirement for a female in her second month of pregnancy is average calorie requirement. Second month, मतलब first trimester. The best answer over here, the best answer to mark over here is from 70 to 90 calorie per day. This is the single best answer you're going to mark. चलें आगे. The RMNCH plus A has been revised to RMNCAH plus N, where the last letter N stands for. So RMNCH plus A has been revised to RMNCAH plus N. RMNCAH plus N, this is the new entity, where the last letter N, it stands for what? Where the last letter N, it stands for what? Newborn, neonate, nutrition, natural growth rate. What do you think? Helper says A, Sara says nutrition, Kumari says A, Sara says A. अगर A बोलोगे बेटा तो ये पहला N किसके लिए? N stands for newborn. मेरा लास्ट वाले N का क्वेश्चन था, where the last N, लास्ट लेटर N, न्यूबॉर्न तो फर्स्ट वाला हुआ ना. RMNCH में भी तो N है बेटा. RMNCH plus A also has N. What is this N stands for? N stands for the newborn. So newborn is not the answer. Neonate is not the answer. The correct answer is nutrition. This is just a factual thing you need to remember. Nutrition is the correct answer over here. This is just a factual thing. You should note what is N. N stands for nutrition. N stands for nutrition. So this is the new program RMNCAH plus N. This is the new program RMNCAH plus N, where R stands for reproductive female, M stands for maternal female, N is newborn, C is child health, A is adolescent, N stands for nutrition, and that is what the MCQ was. N stands for nutrition. So all the programs are listed here. Make sure you take a screenshot of this slide and you know every word which is here. Ace words के ऊपर you should be knowing at least one line. Any student who is a UG student and who's watching this video right now, beta, this one point is going to give you all the MCQs, all the answers in your long answer. इस एक word के ऊपर long question बनता है. This one word is long MCQs in case you are a UG student, in case you are PG aspirant. Every word should be known to you, that you should be knowing ये है क्या. So I'll zoom it for you, take a screenshot of this, and you should be doing every word of this for your exams. ये ultra important है. This is a 7-star MCQ topic for you. एक word आपको at least नाम पता होना चाहिए, that what is there inside the scheme. That is what you need to know. This is important for your INICET exam, INICET exam. Okay, so इसको पढ़ के जाना, इसको रट के जाना. मेरे साथ बोलो. Just try to say with me. Let's do it very quickly. I'll just spend 2 minutes on this. Very quickly, you have to say with me. Home delivery of contraceptives. What is the best answer? Home delivery of contraceptives. कौन से contraceptives home delivery में करते हैं? बोलो मेरे साथ. Say with me. कौन सा contraceptives home delivery में हम allow करते हैं? We are allowing condoms to be given home delivery, and we are going to give OC pills. OC pills 5 rupees. Condom is for 2 rupees or 3 rupees or 1 rupee. Enhanced compensation scheme. Please note where you will study the indemnity scheme, that we compensate in case of failure of contraception 50,000 to 2 lakh rupees. MPV stands for the Mission Parivar Vikas. Under Mission Parivar Vikas, we had launched some of the newer contraceptives. Which were the new contraceptives under Mission Parivar Vikas? We launched the Chaya, the Antra, the Centchroman, that is Chaya, Antra, and one more thing was I-pill, or the Easy Pill. So these were the new contraceptives which were launched under the MPV, that is Mission Parivar Vikas. Next is, what is Suman? Suman we have already done. Suman stands for Surakshan Matritva Ashvasan scheme. Under Suman there is a service guarantee scheme. GSY stands for Janani Shishu Suraksha. Janani Suraksha Yojana, not Shishu, Janani Suraksha Yojana. In this there is incentive given to the female. GSSK Janani Shishu Suraksha Karyagram, Janani Shishu Suraksha Karyagram, where the child is also given care and it is given till infant till 1 year of age. Lakshya program is for labor room quality. PMSMA is for ANC female screening. Midwifery, it is to promote more midwives, or to have trained delivery services even in the rural areas. FRU is to decrease the maternal mortalities by providing blood transfusion units at the CHCs. Chaya, Antra, same components. No, Chaya is Centchroman, Antra is medroxyprogesterone acetate. Someone should type over here. MA, please, any student who's watching this, student के लिए कोई type करे यहाँ पे. I don't have time to type. So please write down. Anybody who knows this, बेटा आप लोग लिखो. What is Chaya? What is Antra? Is it same thing? No, it is not same. Next is MCH wings have been opened in district hospital. No point in this. FBNC stands for facility based newborn care. Facility based newborn care is where we have the NBSU, newborn stabilization units, newborn care units, and we have is the special newborn care units. HBNC we have already discussed, it is home based newborn care. HBYC it is 3 monthly visits. Immunization beta, immunization, there has been important points over here. Immunization is important point that the new dose of FIPV has been started at 9 months of age. This can be asked in your exam. New schedule for FIPV. FIPV stands for the fractional inactivated polio vaccine. It is now given at 9 months of also. It was earlier given at 6 weeks and 14 weeks. Now it is also given at 9 months. Promotion of breastfeeding, it is done under lactational management centers. Lactational management centers, it is to promote breastfeeding in India. Immunization for children, RBSK. RBSK Rashtriya Bal Swasthya Karyagram, it is for Balak. Balak is from 0 to 18 years of age. 0 to 18 years of age, Rashtriya Bal Swasthya Karyagram. How many diseases we are screening under this? We are screening 32 diseases for children under the Rashtriya Bal Swasthya Karyagram. Diarrheal program, you already know plan A, plan B, plan C, and please remember ORS पढ़ के भूल के मत जाना. Do not forget about ORS. पढ़ के तो everybody should go, but ORS is ultra important. ORS composition, ORS indications, when to give IV fluids, when to give ORS, how much ORS to give during first 4 hours, after 4 hours, everything you should be knowing from pediatrics. So SANS I will be discussing. NDDs, National Deworming Days. National Deworming Days कब होते हैं? One is on 10th of February and one is on 10th of August every year. Next is RKSK. RKSK stands for Rashtriya Kishore Swasthya Karyagram, where we are talking about 10 to 19-year-old Kishore and Kishoris. It is for both boys and for girls. RKSK. WIFS is weekly iron folic acid supplements. WIFS stands for weekly iron folic acid supplements, where we are giving iron folic acid supplements to every age group in the country India under the Anemia Mukta Bharat program. Anemia Mukta Bharat program, it is ultra important program. Anemia Mukta Bharat program, I will be doing this under nutrition heading. So Anemia Mukta Bharat is important for you. AFHS, that is adolescent friendly health services. MHS you can leave. School health, that's okay. School health can be asked like who's the in charge of school health program? It is the medical officer. Under school health program we are taking care of the health of the children using the school teachers. They are being trained for conducting the school health. So that was a quick review about the total mother and child health for you guys. I hope you enjoyed listening to this and keep on listening this again and again, and kahin na kahin isi mein se MCQ aayega. MCQ will be from this area. There's no way it is beyond this area. Isi mein se hi hoga jo hoga. Okay, so let's go to the next MCQ. RMNCAHN, where N stands for nutrition. Essential component of the kangaroo mother care comprises all except. So essential component of the kangaroo mother care comprises all except skin to skin positioning of the baby on the mother's chest, adequate nutrition through the breastfeeding, domiciliary support of the mother and her family in caring for the baby. What do you think is the best answer? क्या बोलते हो? Skin to skin positioning. So skin to skin positioning of the baby on the mother's chest, this is correct. Adequate nutrition through the breastfeeding, this is also correct. Domiciliary support, home based support, देना है नहीं देना? Support for the mother and the family when caring of the baby, देना है कि नहीं देना? What do you think? So of course I know everybody has taken A and B are absolutely correct. A तो सही है, B भी सही है. So, right? So they both are true. They both are true. So I'll write down true. What do you think? C या D में से कौन सा मार्क करोगे? Absolutely C is the correct answer. C is domiciliary support is not a part of the kangaroo mother care. Domiciliary support is home based care, right? So there's no domiciliary support. This is provided through the home based newborn care or the home based young child care program. That is what is domiciliary support for. So absolutely correct, domiciliary support. There is something called as SANS. This is not SAA. This is not SANNS. This is SAANS. SAANS stands for S stands for skin to skin contacts. A stands for airway disease, ambulatory support, nutritional support, and emotional support for the care of the baby and for the child. So these are the elements of kangaroo mother care, where we want the mother to hold the baby with her chest to promote emotional bonding, to promote breast cancer, to decrease chance of breast cancer, to promote breastfeeding, and to have the baby, the warmth of the mother is given to the baby, is transferred to the baby. So that is what is the kangaroo mother care. That is what is the kangaroo mother care. Okay. So, which of the following is true regarding gestational diabetes mellitus during pregnancy? Next MCQ, which of the following is true regarding gestational diabetes mellitus during pregnancy? Criteria is FBG more than 126 mgdl. Criteria is 2-hour glucose more than 140 mgdl. It is done as a two-step procedure. Medical nutrition therapy is tried for 2 weeks in the GDM cases. What do you think is the best answer over here? Which one do you think is the best answer over here? So which of the following are correct? 1, 3, 4, 3, 4, 1, 2, 3, 4, or 2, 4? What do you think is the best answer? Sinojos Kudilil says C, option C is the best answer. Which of the following is true regarding gestational diabetes mellitus? So 2, 3, 4 is correct. Criteria of fasting blood glucose is more than 126. Criteria is 2-hour blood glucose of 140. It is done as two-step procedure. Everybody is saying different answers. I don't know why, but what do you think? 1, 3, 4, 3, 4, 2, 3, 4, or what? What do you think? 2, 3, 4 is most common answer which I'm getting. 2, 3, 4, option C. Beta, look at this guideline. This question, ये बहुत frequently asked MCQ है. It's a frequently asked MCQ, and I don't think you should be doing this answer wrong. इसको ध्यान से सुनो. इसको ध्यान से सुनो. Look at this guideline. This is from the Ministry of Health and Family Welfare, National Health Mission guidelines. It was released in 2019. It is for training of medical officers regarding gestational diabetes mellitus screening. This is the same guideline which is also used in the PMSMA, that is the Pradhan Mantri Surakshit Matritva Abhiyan scheme, where we are screening the ENC females for gestational diabetes mellitus. Any pregnant female who comes to the community, we test her for GDM in the first antenatal visit. This is very important. It is unfortunately given wrongly in many textbooks. It is given wrong in many guidebooks. It is given wrong by many faculties. This is Government of India guidelines. I'm not saying this. I did not make this guideline. This guideline, I'm just trying to show it to you what the Government of India guidelines are. So please note, it is done during the first antenatal visit. The GDM screening is not done from 24 to 28 weeks. It is done first time within 12 weeks. Very important. We take 75 grams of glucose, and what we do is direct 2-hour plasma glucose value. What we do is direct 2-hour plasma glucose value. So what is this 2-hour plasma glucose value called as? This is called as beta one-step procedure. The female is coming as non-fasting. There is no need of fasting. There is no need of fasting by the female. So you don't want to ask the pregnant female to go fasting. India is already a malnourished country. So we don't want the females or the children to go on fasting. Fasting is not required. So without fasting, the female will come 2-hour plasma glucose value to be taken in the first antenatal visit. Then in case the value is more than 140 or it is less than 140, if it is more than 140, common sense, it is gestational diabetes mellitus. And if it is less than 140, we do repeat testing at 24 to 28 weeks. This is also important MCQ. So repeat testing is done at 24 to 28 weeks if it is more than 140 or less than 140. Now in case the female is with GDM. So what is the management of a pregnant female with GDM? Now what is the management of a pregnant female with GDM? Now in case the female comes with GDM, now we do the medical nutrition therapy. This has to be done for 2 weeks. After 2 weeks, we are going to do a postprandial 2-hour glucose test as the same test. Like we give 75 grams of anhydrous glucose, no fasting is required. Now if the female is having blood glucose less than 120 or more than 120, if it is more than 120, you start on insulin. So there was how many weeks trial has to be given? 2 weeks trial has to be given. 2 weeks trial has to be given. Okay, and then we shift the female on insulin in case there is no response. Absolutely correct. Absolutely correct. So can't it be overt in the first trimester? Beta, the criteria the criteria that we are taking is 140. For overt, it is 200. Overt is 200. The criteria over here that we are taking is 140 mgdl. So coming back to my story, which of the following is true for gestational diabetes mellitus screening during pregnancy? Criteria is fasting blood glucose of more than 126. This is wrong answer because it is not about the fasting blood glucose. This is false answer. Criteria is 2-hour glucose more than 140. This is correct answer. This is correct option. It is done as a two-step procedure. This is wrong answer. It is done as a one-step procedure. So this is also false answer. Medical nutrition therapy is tried for 2 weeks. This is also correct. So which is the best one? Option D is the correct answer. Absolutely correct. The Miraz, Dinesh, bilkul theek bol rahe. So it is a one-step procedure. It is not a two-step procedure. So two-step procedure is wrong answer. It is one-step procedure. Okay. Rhyme. Next MCQ. Rhyme is for, what do you think is rhyme? Rhyme is for verbal autopsy, method of breastfeeding, promoting family planning to provide emergency child care. What is rhyme? This is a factual MCQ. Factual MCQ. No things to understand in this. Rhyme is a method for verbal autopsy. Absolutely correct. Dekh lenge. Very nice. I think you're super excited about it. Yes, verbal autopsy is the correct answer. Dekh lenge. Yes, you can do it. Ye hui na baat. A chak de fatte. So A is the correct answer. Routine. Rhyme stands for routine, reliable, representative, resampled, household investigation of mortality with medical evaluation. So that is what is rhyme for. RHIME. Rhyme stands for routine, reliable, representative, and resampled household investigation of mortality with medical evaluation. Rhyme is a method for, it is a method for verbal autopsy. It is a method for verbal autopsy to find out causes of maternal mortalities. It is to find the cause of maternal mortality, that why did a female die, and that is what rhyme is for. Routine, reliable, representative, and resampled household investigation of mortality with medical evaluation. Let's go to the next one. Children are screened for all of the following diseases under RBSK except. So we have already had a quick word about RBSK. RBSK stands for Rashtriya Bal Swasthya Karyagram, 0 to 18 years of age, and this Rashtriya Bal Swasthya Karyagram is for a list of 32 diseases. Initially it was list for 30 diseases. It has been increased to 32 diseases. Which of the following disease is not a part of the RBSK screening, Rashtriya Bal Swasthya Karyagram screening? Is it goiter, cancer, rheumatic heart disease, or leprosy? Which do you think is the best answer over here? So some students are saying A. What do you want to say? Which of the following is not screened under RBSK? Leprosy, rheumatic fever, cancer, goiter. Shreyam says B. FOMO medico leprosy. Dekh lenge says leprosy, leprosy, leprosy. Let's look at the diseases which have been included under Rashtriya Bal Swasthya Karyagram. I know that you don't want to see all the diseases, but this is the list of initial 30 diseases which had been taken as a part of the screening program, health conditions which are screened under this program RBSK. So we talk about so many programs like neural tube defects, cleft lip palate, deficiencies can be asked in your exam. This is important. Deficiencies like anemia, vitamin A deficiency, that is Bitot spots, rickets, vitamin D deficiency, severe acute malnutrition, and goiter. These are important for your exam, so make sure that you study this and go. Beta, I don't want you to remember this whole list, but at least ye to pad lo na. Just look at the list. Ye to exam ke liye, this is what you need to remember. Deficiencies, you need to remember anemia, vitamin A, vitamin D, acute malnutrition, and goiter. No, I don't want you to remember the whole list, beta. That's what. Abhinandan, FOMO medico, just look at me. Just look at the screen. Deficiencies, yes, I want you to remember. Deficiencies, yaad kar lo. Baki list, you don't need to do. Neural tube defect, downlift, congenital, chhod do. Childhood diseases, no importance. reactive airway, dental caries. But important is, do you know rheumatic heart disease? Do you remember Jai Vigyan mission? Jai Vigyan mission. Do you note about rheumatic fever? We have to give rheumatic fever prophylaxis. Prophylaxis should be given to 0 to 18 years, below 18 years of age, in case they are known to have any problem with the rheumatic fever. So there is a primary prophylaxis, there is a secondary prophylaxis. So rheumatic fever is one disease you should be knowing. Okay. Next is developmental delays में vision, ये तो common sense है ना. I don't want you to remember all this. But what is important for you to remember is these two diseases. Tuberculosis and leprosy, these have been newly added to the list. And these newly added diseases to the list were added in year 2020, that all the children should also be screened for tuberculosis and leprosy. So any child who is born in India, age 0 to 18 years, you are going to screen for how many diseases? You are going to screen for total 32 conditions. These 32 conditions include tuberculosis and leprosy. So that is what the MCQ was also for you, that which of the following diseases should be screened in case of children. So many students answered leprosy over here. Beta, that is what you should be remembering, that these, don't you think कि आपने nonsense answer किया था? Why did I say nonsense? Because what makes you think that cancer, is it a problem during childhood? Cancer, is it a problem during childhood? Like every child should be screened for cancer in India? अरे goiter is such a major issue. Rheumatic heart disease, leprosy, goiter, ये important diseases हैं for screening under RBS के. Cancer is not at all effective for screening at this level. So cancer is the single best answer you would like to mark for your exam. Cancer is the single best answer you would like to mark for your exam. So श्रेयम बिल्कुल सही था, तुक्का लग गया. कई दफा तुक्का लग जाता है. तुक्के में क्या है? Okay. So in ICDS growth chart, malnutrition is defined as, bolo. In ICDS growth chart, malnutrition is defined as 95th percentile, 3rd percentile, below -2 standard deviation, below -3 standard deviation. In ICDS growth charts, malnutrition is defined as. What do you want to answer? A few questions remaining. So ICDS growth chart, malnutrition is defined as below 95th, below 3rd, -2, -3. Right? So Dr. Domain, yes, that's what I wanted every student to understand, that you don't have to remember the whole list. वो टक 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 तो हर एक ने देखा था. Below 3rd percentile in MGRS starts below -3. बेटा गलत कर दिया, गलत हो गया, देख लेंगे. गलत हो गया. Yes, FOMO Medico says C, Helper says C, MA says C, Abhinandan says C. Beta, please note that in ICDS growth chart, there's a very blurry image, so image is blurred. Don't think that your eyes are gone. So ये image ही ऐसी है. Don't think कि आपको screen में दिख नहीं रहा. So image is blurred. Do not see the image. What you need to see over here is, look at this first level. This corresponds to usually the median, or it can also be the 95th percentile. It is 95th percentile or median, or it also corresponds to the +2 standard deviation. Anything can be asked in your exam. So in case all three are there in the options, then you are going to mark +2 standard deviation as the best possible answer. FOMO says we will also get blurry in the exam. ठीक है जी, आपको भी blurry मिलेगी. So ऐसा नहीं देखना कि अपनी आँख नहीं मलने बैठ जाना कि यार धुंधला हो गया, सबको दुनिया दिखनी बंद होगी. So that's okay. एग्जाम का टेंशन है, दुनिया नहीं दिखनी बंद होगी, ये इमेज ही ब्लरी है. So +2 standard deviation is the best answer for this first cutoff. First cutoff is at +2 standard deviation. The second cutoff, green zone का lower cutoff is at -2 standard deviation, and the yellow zone का नीचे वाला cutoff is at -3 standard deviation. So these levels, plus 2, minus 2 and minus 3. Plus 2 standard deviation, minus 2 standard deviation and minus 3 standard deviation. These are the levels. Beta, when do you say malnourishment? Malnourishment is when the child is in yellow zone. What is the yellow zone? Yellow zone stands for mild to moderate malnutrition. Yellow zone stands for mild to moderate malnutrition, whereas the red zone stands for severe malnutrition. So बस यही तो MCQ था. MCQ was, when do you say malnutrition? Malnutrition, how can you say answer as, what do you think the answer is? -3 SD से नीचे. Wrong answer. उससे नीचे तो severe है. What do you think? Plus 2 SD? No, that is normal zone. So when do we say malnutrition? Malnutrition is when it is below -2 standard deviation. Malnutrition is below -2 standard deviation. So ICDS growth chart, malnutrition will be defined as below -2 standard deviation. Beta, some students are writing on the chat box about the mid-arm circumference, mid-upper arm circumference. MUAC is done using Shakir tape. If it is less than 11.5, it is called as severe malnutrition. If it is 11.5 to 12.5, it is called as mild to moderate malnutrition. And if it is more than 12.5, this is a normal case. So when do you say malnutrition as per the mid upper arm circumference? Malnutrition cutoff is 12.5. If it is below 12.5, it is called as malnutrition. If the child is below 12.5 or below 12.5 centimeters, it is called as malnutrition. Okay. Let's go to the next MCQ. Compared to the cow milk, the breast milk is, what do you think is the best answer? Compared to the cow milk, the breast milk is lower quantity protein, adequate source of iron till 6 months, lower sodium, high fat content, adequate source of iron, or is it low quantity protein? Which do you think is correct? Which of the following is correct? What do you think is the correct answer over here? What do you think is the correct answer over here? Compared to cow milk, the breast milk has lower quantity protein, adequate source of iron till 6 months, lower sodium, higher fat content. Which of the following is correct answer? What do you think is the correct answer? Waiting for your answers, guys. Lower quantity protein, adequate source, higher fat content, lower sodium. So 4 more medico, 1, 2 and 4, 1, 2 and 3. Anything else? 1, 2 and 3. 1, 2 and 3. So many students are going with 1, 2 and 3 and absolutely correct. Beta, 1, 2 and 3 are the correct answers. Very nice. I'm so proud of you. This was kind of a tricky MCQ. Absolutely correct. 1, 2 and 3 are correct. It does not have high fat content. The fat content is lower fat content. So lower fat content is there in the breast milk compared to the cow milk or even to the buffalo milk. Breast milk is deficient in iron, vitamin K, vitamin D, right? Absolutely correct. So if you talk about the breast milk, beta, if you talk about the very quick review about the breast milk, this question can be integrated from pediatrics. I don't know, it can be integrated from gynae. It can also be integrated from community medicine point of view. So if you talk about the breast milk, yes, does it have low fat? Yes, it has low fat. It has roughly approximately half of the fat content from compared to the buffalo milk. So this low fat is there, and this low fat, but the breast milk has low quantity fat, but it has highest amount of PUFAs. This can be asked in your exam. It has highest amount of PUFA. Talking about protein, yes, it has low quantity of protein, but it has maximum amount of casein. It has taurine, and it has cysteine. These all are required in neuronal development. These all, PUFAs, casein, taurine, cysteine, they all are required in neuronal development. Next, it has low sodium. Yes, this is correct. It has the highest lactose. It is roughly double amount of lactose. It has low calcium, beta, and it has higher, not high vitamin C, it has higher vitamin C. compared to all milk sources. So try to listen to me very carefully now. I am not saying that breast milk is going to have high amount of vitamin C. What I am saying is that any type of milk, it could be cow milk, goat milk, buffalo milk, camel milk, human milk, any type of milk, it will always have very low vitamin C. But this vitamin C is very high compared to any type of milk. Vitamin C, listen to it very carefully. If cow milk is there, buffalo milk is there, human milk is there, vitamin C is low in any type of milk, but human milk, it has higher vitamin C compared to any other milk. Similarly, for calcium, it is low calcium. Now, because there is low calcium, listen very carefully, because there is low calcium and there is higher vitamin C compared to all other forms of milk. Therefore, iron, which is, listen carefully, iron, which is also low in any type of milk. Iron is also low, very low in any type of milk, but whatever iron is there, that is absorbed by the human milk. Why? Because it has low calcium and it has high vitamin C. You remember, vitamin C is iron absorption promoter. It promotes iron absorption, and calcium, it decreases iron absorption. It is inhibitor. You remember, calcium is inhibitor for iron absorption and vitamin C is promoter for iron absorption. So don't you think that whatever iron is there, it is adequate for child till 6 months of age? And that is the reason the children, they don't even need extra iron. We are giving iron to every age group in the country. Why not to 0 to 6 months of age? Because the iron is, whatever the child will be getting iron from the mother, that iron is absorbed. Did you get this? So the human milk. So now if you understand the concept, then it is bingo. You are going to get the right answer. That is what I started my lecture with. All the students who were right here from the start, I started my lecture is that what is motivation? Motivation, I can't motivate you. But if I explain you something and you progress in your concept, if you understand something, that is motivating you. That will help you to understand much more in detail, and it will help you to remember for a long time. So you don't tend to forget things which you understand. But if you cram things, कि यार ये घटिया subject कौन पढ़ेगा? So if you cram things, then you are very bound to forget things. But if you understand, you are less chances for you to forget about the things. So compared to the cow milk, the breast milk is low quantity protein. Yes, this is correct. Adequate source of iron till 6 months. Yes, this is also correct. It has low sodium. It is more kidney protective. Yes, this is correct. It has high fat. No, it is wrong answer. So the best answer is 1, 2 and 3. Okay, 1, 2 and 3. Okay, let's move forward. Very nice. Thank you. I hope this should be going with you for a long time. It can be asked anytime in pediatrics, PSM, I don't know, in obs and gynae also. So these are some of the factual things which sometimes can be asked in INICET, but INICET is not known to ask for these type of factual things. Please note that 14th April, it is taken as Ayushman Bharat Health and Wellness Center Day. Weeks observed in health centers under Ministry of Health and Family Welfare. Last week of April, it is World Immunization Week. Intensified diarrhea control is in the last of May until 1st of June, first week of June. So I've just remembered early June is diarrhea control. Breastfeeding week has been asked multiple times in your exam. First week of August is the first breastfeeding week. Some medical colleges will also observe this as breastfeeding fortnight, where they will take the 2 weeks. Nutrition week is in September and newborn week is in November. So there's just sometimes in RCH exams or in NEET exams, some people ask you. Again, this is a flashcard. It has already been shared on my Instagram. It is MMFC number 1087. This is just a small information. It is a 3-star MCQ. It can be asked in your prospective MCQ. It is a prospective MCQ. It can be asked in your INICET exam. This is about the lactational management centers. Lactational management centers is to promote breastfeeding in India and to promote breast milk banks in India. So there are 3 levels of centers: comprehensive CLMC, we have LMU, lactational management centers units, and LSU, that is lactational support units. LSU, not double SU. LSU, that is lactational support units. So these are the 3 levels of lactational centers that we have in India, and in all the, it is usually in the district hospital level. It is usually at the district hospital level where we have these lactational management centers. Let us move to the next MCQ. In nutritional rehabilitation centers, all are correct except initial phase is the stabilization phase. The initial phase is stabilization phase. F100 diet is a catch-up diet. Iron, vitamin A and zinc are given as supplement in the starter diet. F75 has lower protein compared to F100. What do you think is the best answer? In nutritional rehabilitation centers, all are correct except the initial phase is the stabilization phase. F100 is a catch-up diet. Iron, vitamin, zinc supplements are given in starter diet. F75 has lower protein compared to F100. What do you think is the best answer over here? Absolutely correct, Abhinandan Maiti. So student has answered it absolutely correct. Iron is contraindicated. Iron is contraindicated. Iron is contraindicated in starter diet during the nutritional rehabilitation centers. Absolutely correct. Iron is not given in the starter. So Miraz also says iron is not given in the starter. Absolutely correct. Domains 01. Somita Manna, absolutely correct. Nutritional rehabilitation centers. So a very quick review about the nutritional rehabilitation centers. Nutritional rehabilitation centers, these are in 3 phases. You have the stabilization phase, transition phase and the rehabilitation phase. In the stabilization phase, we give a diet that is called as F75 diet. In the stabilization phase, we give a diet which is called as F75 diet. Why do we call it as F75? Because it contains 75 kilocalories of protein energy, and it is 0.9 grams of protein per 100 grams of the F75 diet. Talking about the transition phase, in transition phase, please note, in the transition phase, the diet which is given is the F100 diet. Why do we call it as F100? Because it is 100 kilocalories of diet and it contains 2.9 grams of protein. The protein which is there is 2.9 grams of protein. It is for 2 to 3 days. In the transition phase, this diet is called as the catch-up diet. In the transition phase, this diet is called as the catch-up diet, whereas in the stabilization phase, this is called as the starter diet. And then you have is the rehabilitation phase. Rehabilitation phase is like home-based diet is given. So please note, based on this, if you are able to understand this, please note, very important MCQ. In the starter diet, we give some micronutrients, but iron is contraindicated. Iron is never given in the starter diet. This is the only one point you should be remembering for your exam. So in nutritional rehabilitation centers, all are correct except, so iron is not given, all other are correct. All other are true, and this is true. So F75 has lower protein, F100 is catch-up, initial phases, stabilization phase, all are true except this one, option number C. This is the best answer to mark. Option C is the wrong answer. The biggest triangle, next MCQ, the biggest triangle for under 5 clinic represents family planning, growth monitoring, immunization or health education. What do you think you're going to mark over here? What do you think you're going to mark over here? Iron given for overload. Absolutely correct, Abhinandan. It may cause fluid overload and may disturb the child. So the biggest triangle for under 5 clinic represents family planning, growth monitoring, immunization or health education. What do you think is the best answer? The biggest triangle for under 5 clinic represents family planning, growth monitoring, immunization, health education. What do you think is the best answer? Family planning, growth monitoring, immunization, health education. So some says option B and option D. Growth monitoring, immunization, health education, the biggest triangle. Under 5 clinic, beta. Under 5 clinic is represented by 2 triangles like these. So there is a bigger triangle and then there is inner triangle. In the under 5 clinic, the inner triangle, it represents family planning. The inner triangle, it represents family planning. The 3 smaller triangles, these this triangle, and this triangle. The three smaller triangles on the side, this represents, first is the growth monitoring. Then we have the immunization case, that is the preventive health. That is the vaccines. And last is the curative care, that is treatment of diseases. These are the four elements in the triangle. The fifth element is the outer triangle. This outer triangle is represented by health education. Or the educating the parents, that is specifically the mother, about the care of the child. So these are the 5 elements of the under 5 clinic. Under 5 clinic is represented by 2 triangles and 5 elements. The outermost triangle, this is the most important and the largest triangle. It is the most important triangle, that is always the health education. So absolutely correct. So absolutely correct. The biggest triangle for under 5 clinic represents is the health education. This is the best possible answer for us to mark, and this is the correct answer about health education. Coming to the next MCQ, all of the following methods of contraception can be provided to a female. This is a 7-star MCQ. 7-star MCQ, all of the following methods of contraception can be provided to a female who has 1-month-old baby and is non-lactating. I am waiting for your answers right now. So DMPA injections, Centroman, combined oral contraceptive pills, or copper T375 intrauterine device. Which of the following do you think is the correct answer? So all of the following can be provided to the female except, what do you think is the wrong answer? And I bet on this आप गलत करने वाले हो. I bet on this आप गलत करने वाले हो. ये ट्रिकी MCQ है. चेंज करना, आंसर चेंज कर लो. देख लेंगे से Centroman. FOMO Medico is turn on COCPs. So please note, if you want to change, you're free to change. DMPA, बाकी तो आंसर ही नहीं कर रहे ना, अब मैंने तो बोलना ही नहीं है. So they are like cool. अब सर ने बोल दिया ना. MA says D, copper T375 is not given. Vishnu says C. Most of you says C. So this is a 7-star MCQ topic. It has been asked very frequently. It's a very frequently asked topic in your INICET exam, INICET exam. So Centroman can be given from day 1, whether lactating or non-lactating. Dekh lenge. Yes, correct. Dr. Domain 01 says D. Helper says B. Somita Manna says C. Miraz says D. So Anushri says C. So very nice, all those who have attempted this question, and congratulations for attempting this question. This is, I'm talking from the manual for IUCD's Training of Medical Doctors 2018, Ministry of Health and Family Welfare. Okay, this is not I have made these guidelines. This is a direct screenshot from the guidelines. It is regarding the time of initiation of postpartum family planning method. It is regarding the time of initiation of the postpartum family planning methods. So in all females, we can use condoms, we can use IUCDs. Female sterilization, male sterilization, condoms can be started from day 1. But please note that IUCD cannot be inserted from after 2 days. It can be inserted only after 6 weeks. So during this time period, we are not going to insert any type of IUCD. It is never inserted. So IUCD beta, either we insert, IUCD should be inserted either within 2 days or it is after 6 weeks. It is not inserted within that time. Now comes to this, focus your energy on this non-breastfeeding females. In case the female is non-breastfeeding, now in non-breastfeeding females, we can give the POP injections, or we can give the DMPA, or we can also give the Centroman from day 1, or we can also start surprisingly the COC pills. When do we start them? They can be started from 3 weeks onward. they can be started from 3 weeks onwards. 3 weeks is less than 1 month. So now a female who has a child of 1 month, they can be started safely on combined oral contraceptive pills. Why? Because the female is non-breastfeeding. In case the female now becomes breastfeeding, now the COCs can only be started after 6 months. Now, in case the female is breastfeeding, now the COC can only be started after 6 months. Before 6 months, they should not be started. So what did you learn? When to start IUDs. What did you learn? When to start intrauterine device. Intrauterine device, when to do intrauterine device? Within 2 days or after 6 weeks. When to give COC pills, OC pills. When to give OC pills, it has to be given in case the female is breastfeeding. It has to be started after 6 months. And in case the female is non-breastfeeding, the OC pills can be started after 1 month, or specifically talking is after 3 weeks we can start with the COC pills. So breast milk, yes, estrogen interferes with the breast milk. Now you are absolutely correct. बिल्कुल ठीक बोल रहे हो. So what is the, these are very frequently asked in your exam. And yes, Centroman can be started any day. Centroman can be started any day. Centroman can be started from day 1 after delivery. Why? Because it does not have any hormonal effect. It is only a selective estrogen receptor modulator. And POPs can also be started in non-breastfeeding females. So what is the best answer over here? All of the following methods of contraception can be provided to a female who has 1 month-old baby and is non-lactating, except DMPA injections. Yes, we can give Centroman. Yes. OC pills. Yes, because it is 1 month. And copper T intrauterine device. No, it cannot be given. What is the best answer you're going to mark? It is copper T 375 is the best answer we are going to mark for our exams. Okay, let's move forward. This MCQ. This I'll be waiting for you all to answer. So I'll be waiting for a few minutes. This is integrated MCQ. This is again INICET pattern MCQ. It is a previously asked MCQ and it is a frequently asked MCQ again. A 6-month-old child is brought to the OPD in Health and Wellness Center where the CHO is available. Who is CHO? CHO stands for Community Health Officer. CHO stands for Community Health Officer. These are the nursing officers and they are available at health and wellness centers, which could be available at the sub-centers or they could also be available at the PHCs. So a 6-month-old child is brought to OPD in Health and Wellness Center where the CHO is available. The child presents with fever, respiratory rate of 50. Child presents with fever, respiratory rate of 50, runny nose and cough since last 2 days. There is no evidence of chest indrawing presently. The next line of management, advice to the CHO by you as a medical officer on eSanjeevani portal. What is this eSanjeevani portal, beta? eSanjeevani portal, it is online portal. It is for telemedicine in India. So it is for telemedicine in India. It is to promote telemedicine. So using the eSanjeevani portal, we as medical officers, we are able to talk to our nursing officer colleagues, that is the community health officers, and we are able to help them manage the children in rural areas or even in urban areas wherever the doctor facility is not available. So in these cases, what are you going to advise? So is it to give oral amoxicillin for 5 days, refer urgently for hospitalization, advise home care with steaming and no other medication, give IM Genta oral amoxicillin for 5 days. So C sure hai, advise home care with steaming and no other medication. Abhinandan Maiti, C sure ho gaya, pneumonia is C, C is no pneumonia, child presents with fever. So many students are answering A, oral amoxicillin for 5 days. So what is the age of this child? This is a 6-month-old child. It is a 6-month-old child and the respiratory rate is 50. So what do you think? What do you think? There is no chest indrawing, but the child is having fever. And what are we going to do to this child? Okay. Please note that I know that many students are getting confused. This is what is the, listen to me very carefully now. Listen to me very carefully now. This is, if you see, read this. This is comparison of the previous and revised classification for childhood treatment of childhood pneumonia at health facility. This is the INCI guidelines. These are the INCI guidelines. These INCI guidelines, Integrated Management of Neonatal and Childhood Illness Guidelines, these say that for children age 2 months to 59 months, these are the new evidence, right? This is the new evidence. So this is the old one. Old I'm not talking. I'm talking of the new evidence thing right now. Look at the screen very carefully. So if you talk about the new evidence guidelines, you can see that the child who is 2 months to 59, listen very carefully, 2 months to 59 months of age with cough or difficult breathing. So this is cough and cold, no pneumonia, we do home care. In case of, listen very carefully, in case of fast breathing and or chest indrawing, it is and or chest indrawing. Chest indrawing is not mandatory. In case there is fast breathing, oral amoxicillin and home care advice. In case of any danger sign present, severe pneumonia or very severe disease, we are going to give first antibiotic and refer to the health facility. Okay. Now, if you understand this, this is what is the WHO guidelines. This is what is followed in India also. It is followed everywhere in the world. It is not only for PSM people, it is for pediatrics. It is for any doctor, any medical officer. It is by WHO for any country. This is what is the WHO. But now look at this. This is what is the SANS guideline. SANS guideline, SANS stands for Social Awareness and Actions to Neutralize Pneumonia. This can be your prospective MCQ. Question number 1. What is the full form of SANS? SANS stands for Social Awareness and Actions to Neutralize Pneumonia successfully. That is what is SANS guideline. SAANS. Neutralize pneumonia. It was launched, it was started on 16 November 2019 and it is till February 2023. So this can be asked in your exam. All the guidelines, the detail about the guidelines, if you want to read more about the details on the guidelines, you are welcome to look at my website psmsimplified.com/updates and you will find the whole SANS guidelines over there. So anyways, in this MCQ, I would like to train you for this guideline, for looking at this guideline. So if you look at this guideline, this is management protocol for a child aged 2 months to 59 months. That is from 2 months to 5 years with cough plus minus difficulty breathing. So this is by the ASHA worker. Now this question was saying about the CHO, community health officer. ASHA worker is going to find out whether the respiratory rate is within 1 year more than 50. After 1 year, if it is more than 40. So this is, I don't know why you made mistake over here, but this fast breathing criteria, to yaar, you should be knowing. This is not my job to tell you about the criteria for fast breathing. Fast breathing criteria is very important. How can you forget about fast breathing? You're going to give INICET exam, beta. You have to remember within 1 year if it is more than 50. After 1 year if it is more than 40. Simple sa yaar, 2 months to 1 year, it is 50. After 1 year, it is 40. So if the respiratory rate is more than 50 till 1 year, it is problem, it is pneumonia. If it is after 1 year more than 40, it is problem, it is pneumonia. Now this pneumonia may be with the chest indrawing, with severe pneumonia or whatever. Now you have to manage it accordingly. Now the ASHA is going to refer any case, listen very carefully, the topic I am doing is ASHA worker. Beta, in case there is rural area, the ASHA is going to refer any case of pneumonia or severe pneumonia to the hospital. Listen very carefully. This can be MCQ. I don't want to confuse you, but any case of pneumonia in India, I'll take a new page. Any case of pneumonia in India, pneumonia or severe pneumonia in India by the ASHA worker, what are they going to do? They are going to give oral amoxicillin single dose, plus they have to do urgent referral to the hospital. Are we able to referral to the hospital? Are you able to get this? Urgent referral to the hospital. Now we come over to, did you get this? That was the main purpose of showing you this slide. This is management protocol for children age 2 months to 59 months with cough and or difficulty breathing by the ASHA worker. So this is management protocol for by the ASHA worker. Now comes to the doctor level, doctor or the CHO level. This is direct training guideline I have taken from the SARS guidelines. This is management protocol for 2 months to 59 months for cough and or difficulty breathing by CHO officer at health and wellness center. So it is by the CHO. So they have given specific guidelines for the CHO, community health officer people. So what are they going to do? Let's just zoom into these guidelines. If there is no signs of pneumonia, common sense, there is no problem, advise home care. Simple, common sense understanding. Now, in case the MCQ comes, there is fast breathing. What is tachypnea? It is less than 1 year, more than 50, less than 2 months, it is 60, forget about 2 months. So 2 months to 1 year, it is 50. After 1 year, it is 40. So if the baby is having respiratory rate of more than 40 in age after 1 year, right? More than 40, age after 1 year, now this is classified as case of pneumonia. Okay, and there is no chest indrawing, this is pneumonia, and if there is chest indrawing, it is severe pneumonia. What are we going to do in case of pneumonia? In case of pneumonia, give oral amoxicillin for 5 days in consultation with MOPHC. That is where the eSanjeevani portal comes. Using the eSanjeevani portal, we are going to give oral amoxicillin for 5 days after looking at the child, after helping the CHO also examine at the child. Treat wheeze if present, advise home care and mother to return immediately. Follow up after every 2 days. This is also important. 48-hour follow up has to be there. Now, in case there is severe pneumonia, then of course the CHO will give oral amoxicillin and IM gentamicin, and they have to take care of the oxygenation also, and they have to refer the child to the hospital. So what did you learn over here? What did you learn? What is the learning modality over here? The learning modality over here that I wanted to convey is that in case the pneumonia is managed by ASHA worker, she has to give amoxicillin and thank you bhaiya, please go to the hospital very quickly because pneumonia is lethal in India. Pneumonia, children die. Pneumonia is one of the top 5 causes of death of children aged less than 5 years in India. Now, in case we get a pneumonia or severe pneumonia by CHO, now in case it is pneumonia, in case it is severe disease, in case of pneumonia, they have to give oral amoxy, and in case of severe disease, now they have to give IM genta, or they will give oral amoxy, not or. It is and IM genta plus oral amoxy plus you have to refer to the hospital in case of very severe disease. Do you understand this? And in case it is medical officer, usko to he has to inpatient and he has to admit the patient. Agar ye medical officer hai, that is, agar in case it's you who is a medical officer. Now, if you are the medical officer, you have to inpatient, admit and hospitalize. Admit and hospitalize the case. So that is how you treat pneumonia at different levels using the SARS guidelines. These are Government of India guidelines, SARS guidelines, which have been adopted by Ministry of Health and Family Welfare. There is a slight discrepancy over here with the WHO guideline, jahan pe you learnt about chest indrawing. No chest indrawing was pneumonia, but please note chest indrawing in India for rural areas, we still take this as severe pneumonia. We still take for nurses and for ANMs and for health workers, we still take chest indrawing as severe pneumonia because this is what is SARS guideline, because Bharat ka bachcha, the Indian child is more malnourished and there is more chance of losing the child in case we take leniency on the guidelines by taking severe chest indrawing even in pneumonia, right? So anyways, I don't want to explain to you why did we make these guidelines. There are definite scientific principles by which we made these guidelines. So what is the final? This is the total summary beta. I made a summary also. I forgot to show you. This is the summary of the whole thing. This is the summary of the whole thing. So how are you going to manage a summary algorithm for 2 to 59 days, that is 60 days, that is 2 months. So any case of ASHA, they have to refer. ANM, they will give pre-referral amoxicillin and genta. CHOs, again, they will do pre-referral amoxi and genta, and medical officer is going to hospitalize and treat. Now comes to your point about 6 months, 2 months to 59 months age group. In case it is pneumonia, ASHA is pre-referral dose of amoxi and referral. ANM is treat with amoxi and under the supervision of medical officer using e-Sanjeevani portal or directly talking with the medical officer, they are going to do. CHOs, again, treat with amoxicillin in consultation with MOPHC. That is what this MCQ was asking about. This is what this MCQ was asking about. And medical officer is, of course, to treat with amoxi. In case of severe pneumonia, they are to hospitalize and treat. So this is the summary table. Beta, please note, this is what is the SARS guideline. This is what is the SARS guideline. SARS guideline for you all. You have to remember this. This is prospective MCQ, prospective MCQ. This is prospective MCQ which can come to your exam. Sir, CHO are MBBS or not? No, beta. Anushri, CHOs are community health officers. These community health officers, CHOs are community health officer. The CHO is a nursing officer. It is a nursing staff. And there is very difficult, that is what one of the student was also asking about NORCET exams, CHO exams. So CHO, these are nursing officers, and they are being tested before they are being employed as CHOs, and the level of MCQ is almost similar what I'm teaching you right now. Right? Can you please clarify on most common cause of death in neonates once? I'll try to clarify, beta. On my Telegram group, there is a PDF file. Search for PSM booster. On the Telegram group, there is a PDF file. Search for PSM booster 2023. इस फाइल के अंदर you will see every controversy is being solved. अब तो मुझे I have remembered it by heart because I said it so many times in the group. Go to page number 12. You will find the answer to your most common cause of death. Most common cause of death. Most common cause of death. It is on PSM booster page 12. So what is the best answer you're going to mark in this MCQ, bachche? What is the best answer you're going to mark in this MCQ? 6-month-old child is brought to OPD in Health and Wellness Center. The child presents with a fever respiratory rate of 50 and there is no chest in drawing. Answer is give oral amoxicillin for 5 days and refer. So it has to be solved as per the SARS guidelines. This is the best answer. Oral amoxicillin for 5 days has to be the best answer. Chalo, let's move to the next MCQ. This is previous year MCQ. Minimum number of antenatal visits as per the new WHO guidelines are. What do you think? Join kar lo Telegram ko. Anybody who's not there on Telegram, if you are not there on Telegram, you can go to the PSM simplified website. You go to updates and then download the file. These are the two sources you have. Or in case you are available on Facebook on my Marrolinks group, it's there in the Marrolinks group also. It is every year I come up with a PSM booster. So PSM booster, it is a PDF file. It is a PDF file. Every year it comes just before the exams. It is to take care of all the updates and I give you 20 points in PSM. And every year I'm very thankful to God. Every year we usually get around 6 to 7 MCQs from this single 20 points PSM booster file only. So this is like I started long time back. It's been around 7 years I'm doing this PSM booster files. So every year we get around 5 to 6 MCQs, 7 MCQs from this single file, and this is what is PSM booster. Okay, so if you are there on Telegram, you should be taking it from the Telegram. Otherwise, you have to go to the PSM Simplified website, go to /updates. बेटा ये गलत है आंसर. So 1 to 4 year infection, बाकी सब is hypoxia. Most common cause hypoxia is as per the medical certified cause of death. So anyways, let's discuss this MCQ, minimum number of ANC visits as per the new WHO guidelines. So what do you think is the best answer? WHO guidelines, this is a previous year MCQ. It was previously asked in your NEET INICET exam. The answer is 8 number. So this is, I think everybody should be knowing, as per the National Health Mission, beta. National Health Mission, Ministry of Health and Family Welfare. Minimum how many visits are required? 4 visits are required, 12 weeks, 14, 26, 28 to 32 and 36 weeks till term. So recommended visits are 13 to 14, but minimum number of visits, can you see this? There are 2 words. There is something called as the minimum number of visits, and then there is the recommended number of visits. The recommended number of visits is 13 to 14 visits. So we recommend this as per the National Health Mission. We recommend monthly visits 0 to 7 months, 8th month 2 visits, and then in the 9th month it should be 4 visits. This is what is the Ministry of Health and Family Welfare. Now coming over to the WHO guidelines. WHO guidelines is minimum how many visits they require. WHO guidelines say that minimum we should have 8 visits. WHO says minimum we should have 8 visits. So in the first trimester there is 1 visit, in the second trimester 2 visits, in the third trimester there are 5 visits. Total is 8 trimester. Chalo. There's also a previous year MCQ. A pregnant female less than 34 weeks of gestation reports with mild moderate anemia. What is the best management plan as per the Anemia Mukt Bharat? So as per the Anemia Mukt Bharat program, a pregnant female less than 34 weeks of gestation reports with mild moderate anemia. What is the best management plan? 2 tablets of iron folic acid, 3 tablets of iron folic acid, IV iron sucrose if not tolerating iron folic acid, IM ferric carboxymaltose. What do you think is the best answer over here in this MCQ? This is also a previous year MCQ. It has been asked in your INICET exam. This is, what do you think is the best answer over here? For more medico, I will check PSM booster only now. Too much confusion. Yes, you are most welcome to check it. After the end of the session, I'll be showing you the PSM booster also. I'll show you the answer to this. So IV iron sucrose if the female is not tolerating IFA is what is the answer given. Some students are saying A. So A is 2 tablets of iron folic acid plus iron sucrose. Nahin, galat ho gaya. So please note that in case, this is what is the summary of the guidelines for treatment of anemia. This is the summary guidelines for management of anemia in females. Management of anemia in females. Beta, please note, generally speaking, if the gestational age is less than 34 weeks, we give 2 tablets of IFA. If it is more than 34 weeks, we have to give iron, IV sucrose or IV carboxymaltose, ferric carboxymaltose, that is the FCM. Please note that the ferric carboxymaltose is not given as IM, it is only given as IV doses. So it is, generally speaking, age more than 34 weeks of gestation, IV doses, age less than 34 weeks, we give 2 tablets. In case the female is not tolerating iron folic acid, common sense, you have to give IV iron sucrose. Done? Now in case the female comes up with severe anemia, now in case there is severe anemia, in this situation, now you don't generally see about gestational age less than 34 or more than 34, then generally speaking, you have to give IV iron sucrose. But if the gestational age that is more than 32 weeks, or if the female is in 3rd trimester, very close to her term, now it is important to do hospitalization plus IV infusion, and or even depending on the level of anemia, we may do blood transfusion. If the HB is less than 5 also, we will do blood transfusion. But generally speaking, in severe anemia where the HB is less than 7, what is severe anemia? HB of less than 7 gram percent. HB of less than 7 gram percent, that is from 5 to 7, it is generally speaking we will give IV iron sucrose or IV FCM. But in case if it is less than 5, give blood transfusion. In case it is more close to term, again give blood transfusion or hospitalize. So in case of thalassemia or sickle cell anemia where there is already iron overload because of multiple transfusions, the IFA tablets and iron is specifically not indicated. In fact, it is contraindicated. The treatment has to be done using folic acid. So this is for prophylaxis of anemia, or this is for treatment of anemia, not for prophylaxis. It is for treatment of anemia. Please note this question has been asked in your recent NEET exam, that in case the female comes in the first trimester, what is the treatment we are going to give to her? Please note that in case the female comes in the first trimester, we are going to give iron folic acid tablets only. We are going to generally give iron folic acid tablets, 2 tablets depending on the anemia level in the first trimester. If the female comes in the second trimester, third trimester, then of course we are going to give iron sucrose, and you have already learnt on these. Regarding prophylaxis of anemia. Prophylaxis of anemia is given under Anemia Mukt Bharat program. Anemia Mukt Bharat program, where we are giving 1 tablet of iron folic acid. What is the dose of iron folic acid? 60 milligram of iron plus it we are giving 60 milligram 500 micrograms of folic acid. This tablet is given as daily tablets. It is given for how many months? It is given for 6 months during pregnancy. It is started, please note, this is for prophylaxis. It is started from 4th month, that is 2nd trimester, till term, and again continued during lactation for another 6 months. So during lactation it is for another 6 months. So total we are giving iron folic acid for 1 year. So absolutely correct. This is for prophylaxis. This is not for treatment. But this prophylaxis does not mean that if the female comes with anemia in the first trimester, you're not going to give iron folic acid tablets. We are going to give iron folic acid tablets as usual. So what is the best answer over here? Many students have answered it already correctly. That what is the best answer? We are going to give iron sucrose if the female is not tolerating. If the female is not tolerating iron folic acid, we are going to give iron sucrose to this female. Okay. I think we are just on the last 2 questions, and just to close off this whole topic, which of the following is incorrect about vaccine vial monitor? What is the incorrect about vaccine vial monitor? This is also a previously asked MCQ. Use if inner square is lighter. Discard if inner square starts changing color but is lighter. Discard when the inner square are same color. Discard if the inner square is darker. So what do you think is incorrect? What do you think is incorrect? You have to mark the incorrect answer. This is a previous year MCQ. It was asked just last INICET exam. So which of the following is incorrect regarding the vaccine vial monitor? Use if inner square is lighter. Discard if the inner square is lighter. And discard if the inner square is same color. Discard if the inner square is darker. So what do you think is the best answer? I think everybody got it correct. It is discard if the inner square starts changing color but is lighter. This is wrong answer. It should have been use. So this is the best answer, which is the incorrect one. Option number A is true, C is true, and D is true. So all options are true except the B one. We should be using this answer. Okay, what is the vaccine vial monitor? Vaccine vial monitor, you already know that this is lighter square, which is inner square. Square should be lighter. What is the discard point, beta? The discard point is when the VVM is of same color. When the VVM is of same color, that is the discard point. That is the inner square and the outer circle is same. Okay. Separate video for biostats. Yes, you can go to my YouTube channel. that is this YouTube channel. In that there is a separate playlist for biostatistics, and watch every MCQ in that. This is very frequently all previous year INICET. During these sessions also I have a separate module for talking about biostats. Next MCQ, which of the following vaccine is not under open vial policy? This is again a previous year MCQ, but with some revisions I have done. Which of the following is not under open vial policy? Bolo, कौन सा वैक्सीन है which is not under open vial policy? फोमो मेडिको ने बिल्कुल सही सलाह दी. एब्सोल्युटली करेक्ट. रैपिड रिवीजन इज फॉर एवरी एग्जाम, कवर्स एवरीथिंग. यस, दैट्स सो ट्रू. Next MCQ, which of the following vaccine is not under open vial policy? Oral polio vaccine, injectable polio vaccine, rotavirus vaccine, or the BCG vaccine? What do you think is the best answer over here? Which of the following vaccine is not under open vial policy? So which vaccine is not under open vial policy? What do you want to answer? BCG, rotavirus, injectable polio, oral polio. Which vaccines are not under open vial policy? Please note, what is open vial policy? Open vial policy is that all vaccines which are opened can be used within 28 days except which vaccines? Except the BCG vaccine. If it is opened, it cannot be used within 28 days. Except the measles rubella vaccine. Except the JE live vaccine. Except the rotavirus vaccine and the COVID-19 vaccine. Okay. So please note, there is a recent update. Recent update is that the rotavirus vaccine, which was launched in Government of India before, please note that there is a recent update. It says from February 2023. Please note that the rotavirus vaccine, which was launched by Government of India, initially it was under the open vial policy, but the recent update is now rotavirus vaccine is taken away from the open vial policy. It is under open vial policy. That means if you open a rotavirus vaccine, it can be used for 28 days. Yes, beta, that's why I put this MCQ. You already know this mnemonic, Mera Rota Bichara Jija. Please note, BCG and measles rubella, they are still under open vial policy. Rotavirus is not under open vial policy now, as per the rotavirus is under the open vial policy as per the recent update. So if you look at this flashcard, this is flashcard number 2008. Rotavirus is under the open vial policy. This is news for you. This is new update for you. It is news for you. It is a new update for you that rotavirus is now under the open vial policy. Any vaccine which is under the open vial policy, it will always have the VVM on label for vaccines which can be used for 28 days. But if the vaccine which cannot be used, if the vaccine is which cannot be used, the VVM is on the lid. VVM is on lid. It is on the lid or on the neck. So in those cases, the open vial policy is not applicable. Open vial policy is not applicable. But the new product, can you see this? Rotavac, the new product, the VVM is on label of the vaccine and open vial policy is applicable. So this is kind of a news for you. So make sure that you remember this. This is the news. जीजे ने रोना बंद कर दिया. जीजे ने भी रोना बंद कर दिया. Yes, जीजे ने रोना बंद कर दिया. Yes, that's so nice. जीजे ने रोना बंद कर दिया. Now it's just मैं बेचारा. You can remember earlier I used to give you the mnemonic, right? Earlier I used to give you the mnemonic that मेरा रोता बेचारा जीजा, right? So now the JE vaccine, it is also taken as the JE killed. So obviously this is not, this is under open vial policy. And rotavirus bhi sarkar ne le liya. So who is left in the open vial policy? It is measles, rubella and BCG. These are the only two vaccines which are now under the, to which the open vial policy does not apply. So BCG and measles are the only two vaccines which are left now. So which of the vaccine is not under open vial policy? OPV, injectable polio, rotavirus or the BCG? What do you think is not applicable? It is BCG vaccine is the single best answer. I think many of you had answered this correctly. Ravi Divangan says that please clear the funda of delayed immunization. I'll try to do that after all the MCQs are done. I think just one or two more MCQs. Yeah, this is where your answer is coming, Ravi Divangan. Yeah, mera bichara COVID. That's correct. That's correct. Which of the following is incorrect for the national immunization schedule? So which is incorrect? Measles 1 at 9 months of age, PCV 2 at 9 months, JE at 16-24 months, FIPV 3 at 16-24 months. Which is incorrect? What do you think is the incorrect answer? Which is the incorrect one for the national immunization schedule? Which do you think is not correct right now? What do you think is not correct? Measles at 9 months, PCV at 9 months, JE at 16-24 months, FIPV at 16-24 months. So I think many of you already must be knowing this. Which of the following is incorrect? Which is not correct? Measles is given at 9 months of age. This is true. PCV is given at 9 months of age. This is also true, beta. PCV is given at 9 months of age. Then is Japanese encephalitis 2, 16-24 months. This is also true. FIPV is not given at 16-24 months. It is given at 9 months of age. FIPV3 is not given at 16-24 months. FIPV3 is given at not given at 16-24 months. It is given at 9 months of age. So if you just remember this, this is the 7-star MCQ table for you. This is the 7-star MCQ table. This is regarding the site of the vaccines which can be given under the national immunization schedule. The site of the vaccines which can be given under the national immunization schedule. Oral vaccine we are giving OPV and rotavirus 5 drops. Right upper arm we are giving measles rubella, FIPV1 and FIPV2. This is intradermal 0.1 ml. Please note that the FIPV3 is given at left upper arm, not in the right. The FIPV1 and FIPV2 is in the right upper arm and the FIPV3 is in the left upper arm. ये आपने ज़रूर याद करना है, right? So next is anterolateral thigh, right side. Anterolateral thigh, right side, we have the pneumococcal conjugate vaccine. Anterolateral thigh, left side, we have is the pentavalent, the hepatitis B and the JE killed vaccine. Government of India, initially we were giving JE live vaccine. Now JE live has been switched over to JE killed vaccine and many states have started using the JE killed vaccine, which is given in the left anterolateral thigh, intramuscular 0.5 ml JE killed vaccine. The live vaccine was given in the left upper arm. Okay, and JE killed is not under the, it is to which JE killed vaccine, the open vial policy is still applicable. Okay, so yeah, PCV का भी एक issue है. PCV का भी issue है. PCV2 is not given at 9 months. This is also correct, beta. This is true, false. PCV is given at 14 weeks of age. Yes, my bad. This option needs correction. So JE killed beta, it is the same strain, SA 14-14-2. Yes, Abhinandan, my bad. This is option B is also incorrect. Yes, in case you want to take that 9 months, but yes, it is PCV2 is given at 14 weeks. PCV1 is given at 6 weeks, then 10 weeks nothing is given, and PCV2 is given at 14 weeks. So if you look at the new schedule now, as per the new schedule, this is what is a 7-star MCQ. This is, please note, you have to remember this schedule by heart. At birth, we are giving BCG, hepatitis B, OPV. Then IPV is given at 6 weeks, 10 weeks, and now 6 weeks, 14 weeks, and also at 9 months of age. This is the new thing which has been started. Penta is at 6, 10, 14. PCV is again at 6 weeks, at 14 weeks and 9 months. Rotavirus 6, 10, 14. MR is at 9 months, and JE is again at 9 months and 16, 24 months. Okay. So please note that the BCG can be given up till 1 year. The pentavalent, the hepatitis B, then hepatitis B is given only till 24 hours. Pentavalent, rotavirus vaccine, and the pneumococcal conjugate vaccine, these all can be given only till 1 year. The DPT is given till 7 years, and measles rubella is given till 5 years. OPV is also given till 5 years. This is the max age till when we can give the vaccine. So in case you are getting confused, beta, that what is the upper age limit in unimmunized child, just remember that these are the upper age limit for unimmunized child. Any unimmunized child, you are going to give vaccines according to this schedule only. Okay. In this FIPV, that is also till 1 year of age. So DPT is till 7 years, measles rubella till 5 years, OPV till 5 years. MCQ can be asked that hepatitis B birth dose, it is till what age group? It is till 24 hours. And MCQ can also be asked about OPV birth 0 dose, that is till what time? It is till 15 days. This is what you need to remember for your exam. So Japanese encephalitis, yes, it is till 15 years. The strain that we are using in the killed is still the same, SA 1414-2, and FIPV till 1 year. Yes, that's correct. So this is what is the max age for immunization, and make sure that you get your questions correct. Yes, option B and D both are incorrect, but I wanted to, this is just a misprint. PCV 2 nahi hona chahiye, PCV booster is given at 9 months. Rota also till 1 year. Yes, rotavirus till 1 year. And so with that, I'd like to thank you for watching this whole module, and this is my website, beta. You can visit this website, psmsimplified.com/updates for the PSM booster. Otherwise, you can very well find it on my Telegram group. Instagram is more for updates. Whereas any doubts you have, any controversy you have, or anything you don't understand, just put it on the Telegram group. I am able to see it personally. Telegram, I would not be able to answer you personal message, because there are roughly around 70 to 100 messages per day. So it is obviously not possible to answer it every day. So Facebook group, in case you are a Marrow subscriber, of course you have the privilege of joining the Marrowlinks Facebook group, which is immensely educative group, and it is a very highly educative group. And otherwise, please visit the website psmsimplified.com. You will find most of the updates over there. So waiting for the biostats next week. Is it biostats next week? I think I don't know, I don't remember that. Next week kya hai? Is it biostats next week? It is next week. Next Wednesday. Next Wednesday, it is, we are going to talk about nutrition, environment, and all miscellaneous topics, all other miscellaneous topics. And on 19th April, this is 12th April, and on 19th April, we have the big topic of biostats epidemiology, right? So this is the topic, and every week I am giving you some of the weekly schedules. So make sure that you solve at least 50 to 100 MCQs per day. JE till 15 years, Riya Tyagi, yes, it is till 15 years of age. JE can be given till 15 years of age. So some of the students, many students in fact, were asking about this thing. I'll just show you the psmsimplified.com. This is my website, psmsimplified.com. So in this, you just have to go to this point about updates. Go to this section about updates, and you will see all the PSM podcasts. These are the list of the podcasts which are available on Spotify. This podcast is also available on Anchor FM. So this is what is the PSM booster file I was talking about. PSM booster file which I was talking about. If you just look at this PSM booster file, and this was the SANS guideline. So you can download any of the guideline from here. How to approach PSM booster last year 2022, revision class notes for FMG. So a lot of topics you have over here. Coming to this section about the PSM booster which I was talking is just taking some time to load, I think. So I'm just trying to show you the PSM booster. Yeah. So this is the 20-point PSM booster file 2023 edition. In this, these are the various topics you have. I told you I give you every year, I give you 20 points, which are the frequently asked topics. This year, like in NEET exam, this was the snake bite protocol, which was asked about snake bites. Cancer data, most common cause of death. So just go to this topic. That is what one of the student was also asking, sir, most common cause of death. मोस्ट कॉमन कॉज ऑफ डेथ के लिए अगर आप पेज नंबर 12 पे जाएंगे, this is the same SANS guideline which I had shown to you. If you look at the most common cause of death in infants and in children, it is always, please note, it is always prematurity and low birth weight. Most common cause of death is always low birth weight and prematurity as the most common cause, but the MCCD reports is perinatal conditions, birth asphyxia, hypoxia. If nothing is mentioned in the exams, follow the SRS report, low birth weight and prematurity as the most common cause of death. This will be the single best answer and logically the most common cause also. Overall, for under 5 mortality rates, septicemia is more common than pneumonia, and maternal mortality it is postpartum hemorrhage. So just remember, I have given you points to remember: child mortality, child death rate. So these are some of the topics which you should be remembering. So this is the website psmsimplified.com, and this is the website psmsimplified.com, and just go to the topic on updates and you will find almost everything that you want to download as PDF files for your exam. Okay, so anyways, that was just a very quick review about my website PSM Simplified, and make sure you take note of these sources. Is there a class tomorrow at 9? Beta, this is not a class. I'm not doing a free online sessions every day. This I'm coming only for the students who are preparing for INICET exam. We are doing some 15 to 20 MCQs every Wednesday. Every Wednesday I am live. Every Wednesday at 9 p.m. I'm usually live for 1.5 to 2 hours, and this is only for INICET preparing students who are going for INICET exam. Okay, all the very best. Have a very good night, and make sure that you are highly motivated by taking note of your own progress every day. I cannot motivate you. Even if I motivate you today, tomorrow you might get demotivated. The only motivation that you will get is the amount of progress you make every day. So try solving MCQs, go to the next high level, and next high level. Okay, all the very best and have a good night.